Hi, everybody. Thank you for joining us today for our Understanding Alzheimer's webinar series. This series is sponsored by Terra Vista of Oakbrook Terrace. When someone you care about has dementia, we understand it's a diagnosis for the whole family. I'm Natalie McFarland, Executive Director and Dementia Educator for Terra Vista. Today I'll be talking about the warning signs of Alzheimer's and offering a basic overview of dementia. So I always like to start my presentations off with the difference between dementia and Alzheimer's. Dementia is just an umbrella, very broad term that means confusion or memory loss, change in mental status, or cognitive decline. You can have reversible dementias or irreversible dementias. If we're just talking about reversible dementias, examples could be an imbalance in electrolytes or thyroid levels, or even an urinary tract infection or respiratory infection. And then once these things are treated, it reverses the dementia or the confusion and they go back to their baseline. However, in irreversible dementias, they cannot be reversed. And there are different types of those. Alzheimer's disease is the most common type. In fact, it constitutes up to 80% of the irreversible types of dementia. Some of the other types are frontal temporal lobe dementia, vascular dementia, Lewy body dementia, Parkinson's. There's several others, but again, the most common type is Alzheimer's. So a little bit more about understanding the background of Alzheimer's. The picture on the left is Alois Alzheimer. The disease obviously was named after him. He was a German scientist who first described the disease in 1906 after having his patient on the right, Augusta, a 51-year-old woman. She was presented to him with symptoms with early stage Alzheimer's. And she progressed through the disease very rapidly in about 2 to 3 years. And he was able to then do an autopsy of her brain and look inside and see what we now know today as plaques and tangles. So Alzheimer's disease, it is a progressive disease, and it's very different from psychiatric disorders like schizophrenia, and it's treated very differently too. It is a neurological degenerative disease. So these plaques and tangles build up in the brain cells and actually shrink the tissue by destroying those brain cells. Unfortunately, there is no cure for this disease, although there are medications available on the market to help treat the disease and hopefully prolong the progression of it. So some statistics about Alzheimer's, and we get these statistics from the Alzheimer's Association. We mentioned already that Alzheimer's constitutes up to 80% of the irreversible dementia types in the United States. Some of the other stats, people age 65 and older, and this, again, is just for the United States, 1 in 9 Americans 65 and older have Alzheimer's disease. That number increases by the age of 85 to 1 in 3. 1 in 3 Americans have Alzheimer's disease. Age is the highest risk factor for developing it. Every 67 seconds in America, somebody is diagnosed with Alzheimer's. It is predicted by the year 2050 that that number will be every 33 seconds. It is more prevalent in women. About 2/3 of the people that have Alzheimer's are actually women, and that's because women typically live longer than men. And again, age is the highest risk factor. For a woman in her 60s, she has about a 1 in 6 chance of developing this disease. Currently, there's more than 5 million people in the United States that have been diagnosed with this. And unfortunately, it is a fatal disease and is currently the 6th leading cause of death in the United States. So talking about warning signs of Alzheimer's, number 1, memory changes that disrupt your daily life. So we all can walk into a room and forget why we went in there. That happens to everyone. But the key terms here are that it disrupts daily life. So if this is happening every day and starting to interfere with your daily living, that would be considered more of a warning sign. Number 2, challenges in planning or solving problems. Examples of this might be balancing your checkbook, you know, if it's somebody that's always been really good at that and suddenly they're having problems doing that and calculating and using those numbers, that could be more of a warning sign. It could be something as simple as following a recipe. Maybe they were always once good at following a certain recipe and now they're starting to have difficulty with that. Which leads into number 3, difficulty completing familiar tasks. Other examples of this could be driving to a familiar location and suddenly this person is starting to get lost. Maybe playing their favorite game and now they can no longer remember the instructions or how to play the game. Number 4, confusion with time or place. This is a really common one, and this can be something like remembering the day of the week that it is. And we can all, you know, that can happen to anyone, but again, it's on a daily basis, and the difference is being able to then figure out what the day of the week is, whereas with the person with Alzheimer's has more difficulty recalling and reorienting themselves to the current day. Number 5, trouble understanding visual images and spatial relationships. So although we see with our eyes, actually the back region of our brain is what controls our vision. So the person with Alzheimer's will actually start having difficulty with things like judging distance. Their depth perception is off a bit. Color contrast becomes difficult for them. So light shades can actually look a shade lighter for them, or dark shades, they may perceive them as a shade darker. Number 6, new problems with words. Again, I think the key word here is new. So if you've always been a person who has trouble remembering names, then that's something that's pretty common for you and not something that's new. However, if you've always been really good at remembering names and suddenly you're forgetting the names of those, and these would be people that are even close with you or that you've known for a long time, this could be more of a warning sign. Also, misusing words, or let's say, for example, instead of calling a watch, you might refer to it as wrist clock. Or maybe you can't think of the word pen, and instead of using the word pen, you say, you know, that thing that you write with. Number 7, misplacing things. Again, I think this is a very common thing that can happen to everyone, but it's if it's on a daily basis or happening more and more frequently. The other thing that you want to look for is not just misplacing things, but where are you then finding them? And if that's in unusual spaces, like finding your keys in the freezer or maybe even in the trash can, that's definitely more of a warning sign. Also, the ability to retrace your steps. So if you've misplaced something and you're not able to retrace your steps, that can definitely be a warning sign. Number 8, decreased or poor judgment. So this might be going outside on a cold winter day and not wearing your jacket. Or what also happens a lot to people in early stage Alzheimer's, they are very susceptible to fraud. So maybe they're writing out a large sum of money, a check to a telemarketer or a salesperson. So we really have to be watchful of this. Number 9, withdrawal from activities. So I think this can be related to 2 different reasons. Number 1, I think the person in early stage Alzheimer's, they understand and they're aware that something is not quite right and something is different. And I think oftentimes they try to hide those symptoms from those that they're close with. So that means that they will withdraw themselves from social activity. The other reason being that they cannot follow things anymore. So say a sports fan may stop, you know, watching the sports games because he or she can no longer follow the progression of the game or the wins or losses of the team, that sort of thing. Number 10, changes in mood and personality. So, you know, an example of this might be somebody that gets really upset over something very minor. Maybe they've gone to the grocery store and they've forgotten an item from their grocery list, so they break out into tears. This would be kind of a misproportion of a reaction to something that's just otherwise very minor. So also this can be a person that's always been very easygoing, and now suddenly you're starting to notice that they are getting upset very easily, or they're not as patient as they once used to be. Changes, again, is the key word here. So going into the theory of retrogenesis, this is a theory by Dr. Reisberg, and basically what he concludes is that Alzheimer's disease unravels the brain almost exactly in reverse order as it develops in utero. So there is, believe it or not, a particular chronological order of progression of Alzheimer's, and typically we see it begin in the area of the brain called the hippocampus, and that's where new memory is stored. So that's why you see, as one of the beginning signs of Alzheimer's, forgetfulness and misplacing things and not remembering where you put them. So the person with Alzheimer's in the beginning stages especially, they may remember the meal that was served at their wedding, 40 years ago, but they can't tell you what they had for breakfast that morning. The next part of the brain to be affected is the amygdala. That controls primitive emotions, fear, anger. So you do see incidents of agitation or anxiety that, again, are out of proportion to the event. So like I said, that example before, getting upset at the grocery store if you've, simply forgotten something on your list. The next area is the temporal lobes of the brain. Here on the sides of the brain is where organization of sensory input takes place and processing. So in other words, the temporal lobes control thinking, and they are involved in the ability to learn new things, to express yourself through language, reasoning, decision-making, processing, memory. The next area are the parietal lobes. This part of the brain actually handles touch and spatial awareness, and this is where we process sensations like pain, touch, or heat. So, with the person with Alzheimer's, we really at this stage want to take safety into consideration. The frontal lobe of the brain, this is where early formed memories are stored and self-identity. So this is one of the last areas of the brain to be affected, which is why, again, the person with Alzheimer's disease, they can't remember current events, but they may remember their childhood or stories of, their siblings growing up. Those are their earliest formed memories, and those are the memories that they will have and hang on to the longest. So the last part of the brain, if the person makes it to end-stage Alzheimer's disease, the last part of the brain to be affected is the brainstem. And the brainstem is where involuntary functions occur in the body. So, for instance, your heart beating or, breathing, those sorts of things that we don't have to think about. That's all controlled with the brainstem, and this is why the disease can in fact be fatal. So talking about treatment for Alzheimer's, unfortunately, again, there is no cure to the disease, but there are medications available on the market. There's 4 main medications, 3 in the same drug class and 1 in its own drug class. But basically what these medications are designed to do is prolong the progression of the disease. I think it's important to have good planning and be a part of decision making as part of your treatment. So the earlier you can go and get diagnosed, the better off you are with your plan of care. Also, we want to continue a brain healthy lifestyle, and that would include physical exercise, social or mental stimulation, proper nutrition, even spirituality and socialization. These are all key components to maintaining a brain healthy lifestyle and hopefully prolonging that progression of the disease. And again, doing this sooner in the disease process, you're helping maintain that better quality of life longer. And then intervention strategies and care approach. As part of treatment, basically the bottom line is you want to live their reality. What that means is as you care for the person with Alzheimer's, you always want to live their reality and not try to bring them to yours. So whatever they're living in that moment, you just kind of go with the flow and make your responses accordingly rather than try to correct them or redirect them to our own reality. So early detection is really important. Again, you have a better chance of benefiting from treatment. Some of the drugs are better off being started early on. You can help plan better for your future. You can be a part of the planning. You are more likely to qualify for clinical drug trials. You know, it's important to be able to establish relationships with doctors so they get to know you and kind of get to know your baseline so they can better track your the progression of Alzheimer's. And you also benefit more from care and support. So there are a lot of resources available to people living with this disease or caring for somebody with it. Of course, Terra Vista being one of those resources. The Alzheimer's Association is a great resource, and they even have a 1-800 hotline number that you can access anytime, 24/7, and speak to somebody directly over the phone, whether that be, you know, just a question you might have about this disease or a difficult situation or scenario that you need immediate advice on. The Alzheimer's Foundation of America, although they don't have a local chapter here, but they have a lot of online resource material. And then, of course, support groups and different educational seminars regarding this disease. So we do have time for a few questions. We'll go ahead and start with question number 1. What is the difference between Lewy body dementia and Alzheimer's? So I get asked that question a lot, and Lewy body dementia, again, is one of the irreversible types of dementia, not near as prevalent as Alzheimer's, but it is one of the popular ones that more and more people are learning more about. The symptoms are very similar to Alzheimer's disease, but I think a big difference between the two is Lewy body tends to progress much more rapidly. With Lewy body dementia, the person exhibits symptoms that are very similar to Parkinson's. So sometimes it's even difficult to diagnose, and we really don't know if it's Parkinson's or Lewy body dementia sometimes until time. So people with dementia, people that start having symptoms of dementia before their Parkinson's symptoms or within a year of their Parkinson's symptoms are diagnosed with Lewy body as opposed to Parkinson's. Some of those symptoms can be tremors, stiffness in your joints, shuffling walk, difficulty in your speech, or even struggling with initial physical movement. So question number 2, this is a good one. My husband becomes agitated later in the day. Is he just tired? Again, this is a really common question, and my answer to this, this sounds like it could be a condition called sundowning. This is a very common condition in dementia, especially with Alzheimer's. This, they think, occurs up to about 45% of cases of people with Alzheimer's. So sundowning is when a person with dementia has increased confusion or restlessness or agitation in the evening hours or when the sun is setting. Research points to it being as a result of some sort of disruption in the body's circadian rhythms. So a few different things that you can do to help with this situation. A routine or consistent sleeping pattern is proven to be helpful, and establishing a daily routine is thought to be helpful as well. Increase physical activity during the day so that the person with dementia is more tired in the evening is thought to be better for them, and again helps establish that routine of being up and active through the day and then going to sleep in the evening, nighttime hours. So you really want to watch over napping as well and try to prevent that through physical activity and mental stimulation. The last question that we're going to touch on, my father repeats the same question over and over. How do I get past it? So this can be really frustrating to caregivers, and caregivers experience this all the time. But remember that Alzheimer's disease actually degenerates brain tissue. It's not about forgetting different memories or trying to recall them. It's actually the people with Alzheimer's do not have the ability to recall that information. So you just really have to practice being patient. You do want to validate the person's feelings. An example might be somebody who maybe just ate breakfast, but they're saying, I want to eat breakfast, because they don't remember that they just ate it. So you don't want to say something like, you just ate, I'm not making you anything else. You say something more along the lines, okay, I can make you something in a little bit. And then maybe try what we call redirection. And in conversation, redirect them to something else. That way you've validated what it is that they are saying or that's on their mind, but then you're also redirecting them so as not to cause agitation. So you might find yourself answering the same question over and over, but again, it's really important to be patient. And I know this is a big cause to caregiver stress, which is another important topic, but it's really important to be aware of it and give yourself a break sometimes as the caregiver. And that's why it's so important to have support and be part of a support network and go to things like support groups. So that's all we have time for today. You can check out our website for our upcoming support groups or contact me anytime at 630-534-0886, or you can email me at natalie@terravista.org. So I want to thank everyone again for joining us, and don't forget to check back each month on our website for our next educational webinar.